Hi everyone, Dr. Luke Peterson here with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about iliotibial band syndrome or IT band syndrome, or you may think of it just as that pain on the outside lateral part of your knee. What may cause it after knee replacement surgery, and how do we manage it effectively? So today we're talking about IT band syndrome. You might hear it referred to as iliotibial band syndrome. You might hear it referred to as knee pain on the outside part of your knee, or lateral knee pain. And basically the idea is, so you have your IT band, which is this big fibrous tendon and band-like connective tissue structure, and it's very big, it's very thick, it's very fibrous. It goes from kind of the front outside part of your hip, so your ilium, part of your pelvis, and it runs down to your tibia, so your the condyles of your tibia or your shin bone. So this big band runs from your hip all the way down to your knee and runs along the outside or lateral part of your thigh. And what can happen is the onset of pain and discomfort in this IT band. So the by the book definition of IT band syndrome is having that pain on the outside part of the knee, right where those bones are. They're called the epicondyles. But you can also have people who have pain or discomfort kind of anywhere along the IT band. Usually it's either up at the hip or it's down at the knee more, but there's also people who just have generalized pain along the IT band as well. And so why do a lot of people complain of this pain and discomfort after knee replacement surgery? So one thing to keep in mind is after knee replacement surgery, the shape of your knee joint has changed. So when you have arthritis in your knee and when you have destruction of cartilage in your knee, there is a decrease in that normal spacing of your knee joint. So you have, in a normal healthy knee, a little bit of space in between the two bones of your femur, your thigh bone, and your shin bone. What happens as the cartilage is destroyed, as there's less synovial fluid, less of that lubricating fluid, that space decreases. And as that space decreases, the volume or the shape of your knee joint actually gets smaller. And then now when you have knee replacement surgery, your surgeon's going to try his or her best to improve that normal shaping of the joint. So it's going to improve and return that normal spacing and that normal shape and mechanics and anatomy of your knee joint. And what that means is now the volume of the knee joint has increased and grown bigger, not by much, but significant enough to have an impact. And so now this IT band, this big fibrous band, is actually being stretched out a little bit further. So if you think of a rubber band, or maybe if you think of a rope that's tied to a boat, this band has gotten tight. It's become taut, and it's very tight now. And it was already pretty tight before, but now it's even more taut as the volume of your knee joint has increased. And now you want to add on top of that within your knee joint, you just had surgery. So there's a lot of swelling. There's a lot of inflammation going on. And swelling and inflammation leads to these different things that are going to signal the pain response and are going to be picked up by the nerves in that area and cause pain and sensitivity and discomfort. And so you have a tight IT band that is pulling. You have inflammation and swelling in the area. And now the last thing you add on top of that is we're increasing your activity level. You know, you're doing your physical therapy, you're doing exercises, you're walking, all which is beneficial and very important, but in turn, you're increasing your activity level now after surgery. So all these things together are putting this increased stress on this area. Now, people think that IT band syndrome is from friction. So friction of the band rubbing between the epicondyles, the bony parts of your knee as you're moving, as you're bending and straightening the knee. Some people also instead think that it's more of compression. So instead of friction or rubbing back and forth, it's more that they're just that part of the band is compressing or pushing on things that are underneath it. And what's underneath your IT band, deeper down, is basically this area of connective tissue and fat, but also within there is blood vessels, so vasculature, and there's also nerves that are running in and out. So if this area is being compressed by a very tight pulling IT band, if it's being dealing with inflammation and already hypersensitivity in that area, and it's dealing with increased activity levels, this is where you start to experience that pain of that lateral knee pain, that IT band pain and discomfort and achiness. So what can we do to manage this, to eliminate it, to get rid of it? The biggest thing is just going to be give it time. Give it time for the tendon, for the IT band, and all the connective tissues around your knee to adapt to this new size of your knee. And the best way for it to adapt and to start to not be as sensitive is through activity, through exercises, through walking, through movement. The more you do of that, your body and the muscles and the nerves start to kind of be retrained and relearn, what is something that is painful and possibly harmful and what is okay for the body to experience, so to speak. And so one main thing is give it time and just stay active. There's nothing that's being damaged. There's nothing that's being harmful. You're not tearing your IT band. So that's important to know. You can do activity, work through a little bit of the discomfort and pain, but give it time. The other thing is strengthening. So strengthening and mechanics of how you're moving. So for strengthening, what we want to focus on is strengthening actually your hip muscles. So your glutes and the muscles around your hips are going to provide stability. They're going to help you move with good mechanics and put less stress through that knee joint. So things like laying on your side and doing leg raises, sideline hip abduction, leg raises out to the side, clamshells, things of that nature, and then progressing to more weight-bearing type exercises like squats or sit-to-stands, doing like single leg and both bilateral, both leg type exercises, everything that's going to strengthen your hips and also kind of help you improve and practice moving with good mechanics. Having the knees tracking over the foot, not having them cave into the middle, not having your hip cave in toward the middle and rotate inward, but keeping everything in good alignment as you move and build strength. A lot of people, they'll focus on massage, they'll focus on the foam roller or massage stick, they'll focus on stretching that area. And really, if you think about it, if it's a syndrome that's being caused by compression of that area and compression on the nerves and the connective tissue and everything that's underneath that band, if you're stretching it, you're just pulling that band, you're pulling that rubber band or you're pulling that rope even tighter, and you're actually going to increase that compression. And then if you put a foam roller on that area, now you're putting the external force, the force of your body weight on that foam roller, and that's going to compress even more, and that can lead to even more irritation and discomfort. So a lot of times foam rolling and stretching and things like that, they kind of lead to this short-term relief of the pain and discomfort because it kind of decreases the sensitivity, right? You go through the real discomfort of foam rolling on that area and pushing on that area and stretching it out is really uncomfortable. So then kind of when you do normal activities, you're not as sensitive and it doesn't hurt as much. But this is kind of a short-lived thing. But you're still increasing the compression and the discomfort to the nerves and everything in that area. By building strength in your hips and improving your mechanics and your movements, that's going to lead to less stress and less stresses and pressure on that area in the long term. So don't emphasize stretching and massage and foam rolling as much. Focus more on strengthening, moving well, and being patient and giving time for the tissues and everything to adapt to your new knee as well. Being patient and just staying physically active. If that's walking, if that's an elliptical machine, whatever it may be. So that's my overview of IT band syndrome, why you might experience it and why a lot of people experience it after knee replacement surgery, and how to effectively manage and handle it so that it eventually goes away and is something that is not causing you trouble anymore. Thank you very much for watching, everyone. Please be sure to subscribe. I post videos daily related to knee replacement, preparation, recovery, the actual surgery, and I'd love to hear from you in the comments as well. Have a great day, everyone.